You're watching CTOM TV. Knowledge is power.
Treatment resistance.
Yes. So treatment resistance. So what can happen after somebody's been on tamoxifen or aromatase inhibitors for some time? What can happen is they can become what we call treatment resistant or endocrine resistant, as it's often called. So endocrine resistance typically occurs when what happens is you get genetic mutations in your estrogen receptor alpha. So what can happen is you can have receptors in the, or mutations that occur in the external domain of the receptor. So it changes its shape. And now all of a sudden, certain drugs can't, like tamoxifen, can't bind onto it anymore because it's changed its shape and it doesn't recognize it as a estrogen receptor alpha. You can also get a case where you get a mutation where the outside portion of the receptor actually breaks off. And so you only have the internal portion. And when that happens, what can happen is that then you don't have anything to bind onto the cell and recognize it as a tumor cell. It still has a receptor. And what can also happen is in that particular case, the receptor can, if it's turned on when the external portion breaks off, then it stays turned on. It's kind of like a light switch that you break when the light is on, and then all of a sudden you can't turn that light off. And then what can also happen is the actual receptor can get mutations that cause it to stay stuck turned on, called constitutive signaling. So all of these things can happen over time. But what they are is they're genetic changes. They're changes to the estrogen receptor. Now, there's other things that can happen too. What can happen is in an estrogen positive breast cancer, all of a sudden the HER2 receptor, which is normally at a normal level, it can develop mutations and it can start signaling by itself. And you can also get something else called MET amplification, which is a gene that gets over amplified. So the two things that cause resistance after 5, 6, 7 years of being on endocrine therapy are mutations to the estrogen receptor and mutations to the HER2 receptor. So those are the most common things that can happen.
Thank you for watching CTOM TV. Subscribe below and stay informed.